let me say that there are still some important and open issues, and there are some conflicts taking shape, and I'll just list off a few of them, and hopefully we can have other people in the panel comment. There's a huge question about whether or not there will be a public health insurance option. What the president said again during the campaign and said since is, look, if you like your health insurance, if you like your providers, you can keep it. You keep them. You keep them. We can make it cheaper for you. Keep it. But if you don't like it, then you should have another choice. You should have another option. And in fact, there should be another choice or option for those who currently are not insured. So there is great debate in Washington, D.C. now that is mostly broken down along partisan lines about whether or not there should be a public health insurance option. Public health insurance option can be structured in any number of different ways, including a way that it would, the idea is to have it compete on a level playing field with private health insurance. So I think it was mentioned earlier that Medicare and Medicaid underpay. They don't pay healthcare providers the value of services that are being rendered. The idea of this would be, it would have to be created in such a way that some reasonable value is paid more than what Medicaid and Medicare pay. So I'll just put that out there. But there is still controversy over this. As it emerges, I think we'll hear a whole lot more. There is potential controversy over what the subsidy structure will be if we're going to cover everybody. Folks who are, folks who have a family of 4 and have less than $50,000 a year in income, who are living at the poverty level or even twice or 3 times the poverty level, are simply, they can't afford health insurance now, and they're not going to be able to afford it if they have to pay out of pocket for the entire thing. So part of the cost of this is, how do we subsidize? How do we make sure that we cover those who can't afford to be covered now? That has to be part of this. And there is room for debate about how that proposal is structured. There is the potential structure of any business pay or play proposal. So let me say this. The emerging proposals in Congress will require employers, businesses over a certain number of employers, so not micro businesses, not small employers, but likely larger employers, either to offer health insurance to their employees or to pay, we call it a fine, to pay a fee into a fund that helps to provide coverage for those who don't have it. Again, potential for controversy, business communities weighing in a very large way. We'll have to see how it gets structured. There's something called comparative effectiveness research that has been another matter of controversy. Mostly the pharmaceutical companies they've begun running ads about it. I don't know, has anybody seen the Swift Boat Veterans Against Comparative Effectiveness Research? Basically, comparative effectiveness research, the idea of it is to identify procedures that provide the best medical results at the lowest cost, and to make that information available to healthcare consumers and to healthcare providers. There apparently is a series of ads the pharmaceutical industry has sponsored. They hired the advertising agency that ran the Swift Boat Veterans ads against John Kerry during the Kerry campaign. We don't think the ads are very effective. I'm not sure. If none of you heard of them, they haven't been ringing anybody's bell, it sounds like. Gosh, let me see what else. I guess the last thing is one of the most important pieces of national health reform is really about shared responsibility. That because in terms of components, what we're talking about more than likely is an individual mandate. So you as consumers, you have to be covered. You have to be. And it means you either need to purchase coverage, or you need to purchase it with some subsidy if you can't afford it. But you have to be in. You have to play. If you don't, there will likely be a tax penalty for you. Again, to help pay the system costs. Second, employer pay or play. Again, we talked about it before. But for the business community, that's some responsibility. That's some sacrifice. There is likely to be intensive private health insurance regulation and probably competition with a public health plan. I shouldn't say probably, there's a decent chance that there will be required competition with a public health plan or a public health co-op of some kind as a way to help leverage private health insurance behavior. But some sacrifice, some responsibility on their part. There are going to be transformed payment and practice incentives for healthcare providers that we talked about. Again, some responsibility on their part. And on government's part, we're talking about important and related funding and regulatory responsibilities on the part of government. For this to happen, for this kind of paradigm shift that involves all of us participating, it involves all of us sacrificing in some way. First of all, your voices in this are really, really important to the rest of the delegation. And second of all, we really do need powerful and effective and unifying leadership. Thank goodness it actually looks like we may have that in the Office of the President now in a way that we never have, or we may not have for a while. So I'll just close by saying this. I often reminded of this Winston Churchill quote that Americans will almost always do the right thing, but only after exhausting other alternatives. And I think we're there.